Next, I get to introduce another hero. If you could go into a part of the country that needs it badly and pick one of the most pressing public health concerns for children, and go there and move that needle at a community level and do it fluently in 2 languages, you might be Dr. Stephen Pont. Additionally, if you train in martial arts, you never tell anybody that you train in martial arts. I can't tell you how I know that. But Dr. Pont is an accomplished martial artist along with his kids. I can't tell you how I know that either. Additionally, Dr. Pont is an assistant professor of pediatrics and medical director of the Texas Center for the Prevention and Treatment of Childhood Obesity at Dell Children's Medical Center in Austin, Texas. He's a member of the Texas chapter of the AAP, as well as numerous councils and sections, including the section on obesity and, yes, the Council on Communications and Media. Please join me in welcoming Dr. Stephen Pont.
Thank you for the kind introduction, and I will acknowledge that Dr. Hill earned his black belt before I did, along with his kiddos, so maybe there's fellow martial artists out there in the audience as well. And I also noticed if there's pediatricians out there that Twitter appears to now be working, so feel free to push out all those backlog tweets from before. So first, I don't have any financial disclosures to make. But I do think it's important when we're talking about childhood obesity and obesity with adults, because most of our kids we care for, if they're faced with obesity, then probably their parents are challenged by that as well. It's important that we do acknowledge that that's a difficult topic to cover. And so I acknowledge that I'm passionate about what I do, and sometimes that can lead me to be impatient because I see all the stuff that my patients and their families can do differently to help them all of a sudden get healthier. But I need to put that in check sometimes so that I meet my patients where they're at and then move them forward. And then I also share with my patients that I was a bigger kid growing up, and so I have to make choices daily as well in order to maintain my weight, and recognizing that it's tough for everybody. But specifically with obesity, because it comes as such a zinger in our society, that we have to be mindful of our word choice and the words. And when we're using that term, I make sure I acknowledge with my patients and their families that it's a medical diagnosis. And once we establish that, we tend to use other words to describe it, but being mindful that we're not using it to create guilt or blame or touch on feelings of stigma or bias that are really going to be very counterproductive to what we want to accomplish. So briefly, what we're going to talk about, and once you see this slide, you can stop listening or keep listening. So be nice and be patient. Offer a menu of choices for our patients and their families to choose. Basically, similar to working with picky eaters, we provide and the patient decides. The parent provides, the patient decides, or us as the provider. And then regarding screen time, working towards recognizing the potential benefits for some types of screen time and enjoyment and other things, but we're looking for moderation there and helping them to work towards that. So the super smart folks at the used to be called Institute of Medicine, now National Academies of Science, came up with a great report in 2013 focusing on 5 big areas that we should be working on if we want to try and reverse this obesity epidemic that we're facing. So key areas that we'd all think about as well. So 1, trying to encourage more physical activity. 1, trying to work with workplaces and also with healthcare of what can we do to make progress in this difficult area. Working towards promoting healthy eating, and then specifically also marketing what's healthy. So just briefly unpackaging that in the areas that maybe are most important to us right here. 1 is that us as healthcare providers tend to report that we're not super comfortable talking about weight and obesity and health behavior change because that wasn't a key element for many of us when we went through training. So that's a key opportunity where we can learn more about what are the most effective ways that we can help our patients make some of these changes. And then another one, since we're talking with PEDS21, and it is so awesome to be here with you guys, that focusing on the media aspects and how that can play a role regarding obesity. So 1, if we think about sitting in front of the TV, 1, they're more sedentary time and not active. 2, when we look at what types of programs kids are exposed to, and perhaps more importantly, the commercials that they're exposed to, they tend to be for unhealthy food products, much more so than healthy products. And then the sneaky one is the mindless eating that occurs when we're watching the TV. and how that all weaves together. So really being mindful of that. And there was one neat study that came out that had two groups of kids, both exposed to the same TV show and the same amount of commercials. One set of commercials were food-based, and they gave both sets of kids a bowl of goldfish. The ones who had the same show with the same amount of commercial time but had food in the commercials ate more goldfish as well. So there's sneaky stuff that goes on while we're watching programming, and then also promoting those less healthy choices when we're not watching TV as well. So why do we care about screen time, specifically regarding obesity? Lots of studies are coming out that are, again, making this case why it's so important that we consider this when we're talking with our patients, and it's a great opportunity to make a healthful change for them. So one, preschool years, we're seeing the greater the exposure in the preschool years, the greater the risk and development of obesity and being challenged by your weight in your future. Even kids as young as 2 years old, that each hour, there's an incremental increased exposure risk, that the more they're exposed to, the greater the risk as well. We see that also the mobile media and the screens that are everywhere now, that's another form of, again, sedentary behavior and increased risk of obesity in the future, and more studies are coming out to promote that, and so it's so wonderful to see these new guidelines come out. And then also, even as little as 1 to 1.5 hours of screen time can increase your risk for obesity. Again, these are all just risk factors, so we can mitigate those, but the first place we need to start is being aware of what the risks are if we're going to make a turn towards the future in a more positive direction. So total number of hours increases the risk. TV in the bedroom increases risk just generally, and then there might be some negative synergy as well as far as its negative impact on sleep. And when we see the quality and the quantity of sleep decrease, that risk for obesity increases and greater difficulty in making a healthy change becomes more difficult too. And then also some promising studies that decreasing screen time can also result in BMI. So we're seeing actually people are testing it and it's working. So not just associations, but actual solutions that are working. And so what's this mechanism of action that's linking screens to obesity? Again, we're seeing more and more that the sedentary time, the changing in food choices during watching the programming and then after, because again, all the marketing is for, and we're doing better with it, but it tends to be for less healthy stuff. As we see Disney and other groups pulling off their characters from less healthy products, those are steps that are definitely in the right direction. But again, you go to the store and see what that colorful packaging with the neat characters that our kids recognize, what type of products those are associated with, they still tend to be for unhealthy products. And what kiddo doesn't want to eat what Iron Man eats, right? So being mindful of that and helping to empower our patients and their families. The other part is, if we think about the images that folks see on TV, tends to oftentimes be for, well, in magazines more so, but images that aren't even of real people because they've been altered and look differently, and really creating body images that are not even achievable, and also weaving in the weight bias. So people who are challenged by their weight are lazy and they're weak-willed, and then if their kids are challenged by their weight, then they're horrible parents too. And we see programs that are out there, like one of my all-time least favorite shows, being The Biggest Loser, again, promoting this thing that it's just about laziness and poor weak-minded folks, rather than looking at everything else that's going on. So social media and obesity, again, it can have some positives, but also can have some challenges as well. As mentioned before, it could be a support group for our kids and our patients, so there's opportunities there. It's a ways kids can express themselves, but it also is an opportunity where they can be bullied and teased, sometimes in ways that are harder for us to detect as providers and as parents as well. Also, again, it's an opportunity for direct advertising to our kids that we, again, as parents might not be aware is occurring. And so being mindful of those things and really encouraging those conversations with our parents to have with their kids, and us as parents to have with our own kids. Screen time and sleep, more things are showing, and many of you guys here who do the research that's so important to have to create that evidence base, but seeing how screen time can impact sleep negatively, that just the total number of hours of exposure can affect sleep. Watching screen time right before we go to bed can make it more difficult for our kids to go to sleep as well. And some studies are showing that right before bed, not good, but even some are suggesting total hours of screen time might also affect sleep later, even if it's not right before they go to bed. So again, this stuff's out there and we need to be mindful. So just like many of us probably feel that we aren't getting enough hours of sleep each day, and same thing with our patients and our kids, if we feel tired, then we're going to be less likely to want to be active. We're going to be less likely to want to cut and wash the vegetables and eat them. We're going to more go for boxes and bags and eat out of those instead. Then we also have less stress tolerance and increased mood lability and more arguments at home, and all those things are little factors that make it more and more difficult for people to be healthy. So now, making the case for the challenges regarding screen time, what are we going to do about that? So first, it's never too early to start. It's always easier to keep the screen out of the bedroom than to try and pull it out later. So we need to be putting that message out there as soon as possible with our patients, and it's going to be so much easier. But, we also care for adolescents and teenagers, and those kids need good care as well. So it doesn't mean that we forget about them. We need to work on helping to limit their screen time and try to get that out of their bedrooms as well. And again, so it's never too early to make a healthy change regarding screen time or any other health behavior. And it's also never too late. Almost any medical condition out there will improve with better nutrition, with better physical activity, and likely with more healthy exposure to screen time. So even for our parents and our grandparents who have significant medical challenges, a healthy change is going to help them as well. So when we're communicating about these topics, what are we going to do? One, so be nice. Two, be patient. We have to meet our patients where they're at and then slowly move them forward. Because if we jump too far ahead, we're going to leave them behind. And being mindful that our approach to encouraging the behavior change, it really ultimately can save time. It'll improve our impact, and it'll be a more rewarding conversation. And some of these tips, it's really meant to be used when we have the time to do it. It's really about hitting the easy button, using things like motivational interviewing and the way that we communicate with our patients. Doesn't mean we have to have an hour-long therapy session with everybody, but there's the spirit of motivational interviewing. There's zero-time things that we can do that improve the encounter that we have with our patients, and doesn't lose any time. It actually improves it. So generally with motivational interviewing type approaches, it's going to save our time. We use it when we can, learn the spirit of motivational interviewing, and weave it in when we're able to. If we have a bit longer to spend with our patient, there are key skills we can learn about motivational interviewing that can help facilitate that conversation. But even things that take zero time, like asking permission before giving advice, doesn't take any time. It might be the end of the counter. Hey, would it be all right if maybe we could come back and talk about that at another time? But if you like, I could give you some information if you like that you could read over and come and we could talk about it at the next visit. Instead of, here's some stuff, will you go home and look it over, and then we'll talk about it later. Just asking if you can give it first. If they're in your clinic, by definition, they care about what you have to say. But just that little twist of asking permission before you give the information, it changes the tenor of the conversation and makes our patients and families far more receptive to hearing it. So when we're trying to think about making health behavior change, or if we hear about this, average of 8 hours a day of screen time exposure, we want to try to reduce it. What's our normal approach to trying to encourage that change? So one, we're going to let them know how important it is to make the change. All the research showing that the screen time is going to impact our family time, is going to impact healthy living, and all these other aspects. And if we give them insight, they're going to change their behavior. And then it's really just an educational deficit, so we provide them more knowledge, and that will also instantly result in quick behavior change. We're going to give them skills so they can navigate that as well. And if that doesn't work, well, we just make them feel bad, because then we can unload our responsibility. We did all we can, it's now on them, and they can run forward with it, right? So we have a kiddo, he comes home after school to his apartment, he snacks, plays video games, finishes some of his homework until his mom gets home, doesn't eat much fruits or vegetables, not much physical activity, and lots of screen time, all that video game time, computer time, screen time, doesn't play outside his apartment complex or at his local park, he has severe obesity. What a horrible family he lives in, right? He's a bad kid, he's got a bad parent, it's a bad society. Those are all thoughts that are normal to pop into our minds, but it's a matter of what we do with that, and then really unpack the story to see what's going on if we're going to make a positive change. And most of those factors tend to be much more personal, right? So maybe they live in a tough part of town, single parent home, two parents, they're barely getting by, they both have to work, they're not there. The park's not safe due to gang activity. The apartment complex doesn't allow kids to play in the parking lot. They don't have a grocery store with a food that they can purchase that's healthy, or they don't feel they have time to prepare it. So the safest place for the child is to go home into the apartment indoors, and they know they'll stay there if they're playing video games. So when you put it in that way, maybe it is the best that they can do as parents, and we need to think about some of the other factors that are playing there as well. But oftentimes, and certainly in my state, tends to fall a lot on personal responsibility without looking at all the other aspects, that those are all really focused on individual factors. And we have some folks who are going to be successful regardless, but most are going to experience great challenges if we don't look at things beyond just the individual factors that are going on here. Layer on screen time, layer on sleep, makes it more and more difficult, right? It's not just about energy in, energy out, just change the calories and the physical activity and it all takes care of itself. I mean, it is that simple, but every factor that plays into that then gets rather complicated. Sort of like the socio-ecological model that we think about, not just individual factors, but family norms, environmental settings. You live in a rough part of town, there's gang activity in the park, that's hard to solve as one person. Maybe you can if you're like crazy prodigy advocate, but most are not going to be able to. So we have to look at all those other factors that are at play as well if we're going to be successful. So now going from the macro down to what we can do in our clinic. We need to recognize that those thoughts and feelings and a little bit of like, man, come on, parent, I want to shake you and want you to do a better job. We got to realize our baggage and our bias that we bring to the conversation as well. And even if there are really things that we really think the parents can do better, it's a matter of how we frame that if we really want them to be productive and actually make that change. So first, specifically regarding obesity, there's so much guilt and blame and stigma out there. And we're in the final stages of finishing a policy statement for weight bias for the AAP, which I think will be really nice. No bias because I'm one of the authors, but it should be really good. But there's so much guilt and blame and stigma out there that our parents or patients are coming in with these walls up, and if we don't create an environment where we can have a sensitive conversation, we're not going to get anywhere. Those walls are up, and we need to bring them down if we're going to be productive. If we don't recognize it, it's going to be a waste of everyone's time. Because guilt and blame don't motivate change. They just make you feel bad, and when you feel bad, you're not motivated to do those things. We have a quick window of 10, 15 minutes with that patient. Once they leave, it's their control, so they can pretend like they're listening, but it's not productive if we're not smart about our time. So, is this conversation a surprise? Are they even aware that the kid's faced with a challenge? So just a quick game of guess the percentiles here. This is a weight progressed kiddo from Pediatrics from a few years back. Kiddo here, 55th percentile, 75th percentile. This kiddo here already falls into having obesity. So most folks looking at that kiddo would think maybe he's a little bit bigger, but certainly doesn't have obesity. And if we don't think that as providers, and research shows that we visually can't tell because our kids have gotten so much bigger, parents probably can't tell either, right? So we need to be mindful when we bring that up, not assuming that our parents of patients are already aware of the challenges that the kids face. And if they have mild obesity, they might be running around active doing all sorts of stuff. So it doesn't mean they're a bad kid or not healthy right now, but great risk for stuff coming down the line. So when we're talking about sensitive stuff, it's really important that we do a few things. One, we're pediatricians, we're the nice doctors, right? And if there's family practice folks or other people, y'all are nice too, but we like to think of ourselves as we play with kids, and so we're nicer. But building that rapport. So hopefully we have it, but if not, being mindful of it, that we ask permission before we give information. And then let's not waste time. Our parents and our patients, they might already have thoughts and have tried things. So let's find out what they know first before we just assume and start throwing information at them. And really, we want to empower them to be the ones making the change. Because if I throw the idea out to someone, it's not necessarily going to work. So again, thinking about, is this a surprise visit? Does the kiddo know why his parent's there, that the parent's worried about weight, but the child isn't? Maybe we're worried and the parent's not, so being mindful of that. But the really most important thing is being empathetic, that we're partnering and we're team patient. We're not condescending physician looking down, giving all of our smart information and assuming that they're going to be making that change. So if we're not feeling empathetic, we all have busy days. We all have days that, one of the counter doesn't go well. I mean, just fake it because it will be more productive. So we're professionals. We can do stuff and still work it through. And if not, come out of that room, just shake it. I mean, right? You're chuckling. I'm doing that. Do that if you feel bad, and you'll feel better. You'll feel silly. If your staff laughs at you, then everyone's just de-escalated. You go into the next encounter and feel better versus building up that feeling as you go. So real briefly, just to kind of finish up, what do successful families do? Small changes that stick. It's a lifestyle change. The ill, sick society out there is not going to change tomorrow. We can do a crash diet for a short period of time, but we really need to focus on small changes that can build over time. Make changes as a family. Kiddos not going to be able to all of a sudden make all the healthy choices themselves. If the parent does something, it means it's important. If they don't do something, it means it's less important. If the kids do it, if the parents do it, the kids are more likely to follow. And then keeping it positive, because we have all that guilt and blame and stigma specifically about obesity floating out there. And brief aside, like mental health, very similar with all that guilt and blame and stigma. So we want to be mindful of keeping it positive, encouraging positive reinforcement, not negative, like don't eat that, you're going to gain weight. More, hey, I'm so proud of you that you tried that vegetable, even though you didn't like it, you know? I'm so glad you had that bite of salad and moved forward from there. And really, the success is just, we just want to tell them success is just coming back for the next visit. If we set goals, they don't work, that's more information we can use to set a more successful goal moving forward. But as we become more comfortable making those healthy changes in the goal setting with our patients and families, I think us as professionals are going to be able to help them set goals that they can achieve. And again, there's no failure, just new knowledge of what works and what doesn't work, and we can build from that. Word choice, super important, and so not letting them know they have a diagnosis of obesity, that's okay, but continuing to use obesity and words like that, it's not going to be helpful for us. And so there's more and more studies and research that are showing us words that tend to resonate better with families. So again, be nice, be patient, and this approach can really help. My handouts are all available, and I just want to show you a couple of resources from the AAP that are super good. So Change Talk, it's a free, you can download the app and even check it out now from the AAP, and that's Bob Schwartz there. They have a cool marketing thing for a Change Talk where Bob was wearing his like same outfit, so I had to take a picture of him, and that's what he was wearing as the avatar. So check it out, Change Talk, super cool. It's phone and website, teaches you motivational interviewing, and you can practice it. There's like a change meter that's above the parent and the patient, and it has a nice scale of stuff. Healthy Active Living for Families gives tips for kids 0 to 5. Again, we're not looking for an infant to lose weight, but a small change early on can prevent a lifetime of challenges. 5210, nice motif as a starting point for conversations. And then we have some new great resources that are coming out in collaboration with the AAP called Next Steps, which is the next phase beyond 5210. And these are available in our Academy bookstore as well. So theme-based visits for childhood obesity beyond 5210, which is 5 servings of future veg, 2 hours less screen time, 1 hour more physical activity, 0 sugary drinks. This is a number of additional topics that can be covered with the flip chart. One side faces the family, one side faces the provider, and helps you or anyone else in your staff or clinic have that conversation. So it's kind of a new science regarding childhood obesity, but with the AAP, we've got a ton of more resources, so there's a lot of additional work we need. So having such a full room to talk to is spectacular, but I really feel like we're making some great progress, and with you all's help, I really do think we can reverse this epidemic. So, thanks.